Welcome to Dr Joe Unplugged. The topics discussed in this podcast will reflect my opinions and are not in any way to be regarded as medical advice. We're going into winter in the Southern Hemisphere, and winter is, of course, a cold, virus, flu, and maybe chest infection season. And for children, it can also be ear infection season as part of or related to that. And yes, some people get sinusitis too. Now, all of these can occur 365 days of the year. It's not that viruses disappear in warmer weather, but we all know that in wintertime, generally speaking, if you're likely to get some form of illness, it'll be more likely in wintertime. And there's different theories about that, including people might spend more time indoors. And also the other interesting theory is people may have lower vitamin D levels because we're not outside in the sunshine as much. And look, maybe it is just seasonal as well. Back maybe 50 years or so ago, anybody who had a cold was typically treated with an antibiotic. What we've learnt over the years is that most illnesses that people get, not all, people do get bacterial illnesses, and bacterial illnesses will benefit from an antibiotic in certain circumstances. But viral illnesses, whether it is a cold, whether it is a flu or a flu-like illness, and there are a lot of variations on these themes, they're not going to respond to an antibiotic. And we've also learned, and there's issues at the moment with antibiotic resistance, and there's not been a lot of new antibiotics developed over the last couple of decades. And again, that could be a whole separate podcast as to why that's the case. But we also know that the idea of, even if I don't need it, it doesn't matter, doesn't apply. We can knock out a lot of our good bacteria if we're taking an antibiotic unnecessarily. And there's a lot of work that suggests it's a good idea, and I would personally think it's a good idea to take a probiotic if you do need a course of antibiotics. But there's also been work that shows, and this is a new study that confirms this. That's not the first one that has shown this, and we'll put the link in the description. Children who received multiple antibiotic courses between birth and 2 years of age had a higher risk of developing asthma, food allergies, allergic rhinitis, which is like hay fever, and this is actually a new one, and intellectual disability, according to a new study. Data from 685,000 children, 53.4% girls, were exposed to antibiotics within 2 years of birth, and all their data was analysed. Now, once again, statistical correlation has to be seen as just that. Statistical correlation is not quite the same. In fact, it's not the same as cause and effect. But we know that the human microbiome, which is the bacteria that we have in various parts of our body, including the gut, the back of the throat, on the skin, they're not just there for the sake of it. They actually serve a role and a function, and if we disturb them, there can be problems. And the risk of asthma, overall antibiotic exposure before 2 years of age was associated with an increased risk of asthma compared to sibling-matched analyses. Also showed that data. So you've got two siblings, one gets the antibiotic and one doesn't, and the one who does is more likely to get asthma. Again, there are other reasons. It's not an absolute. The risk was higher amongst children who received 5 or more antibiotic courses. And again, we saw before about some of these other allergic conditions. So what that says is that there is a downside to unnecessary use of antibiotics, apart from all the others that one can go through, which means that the idea of just in case or, there's no harm is actually quite wrong. There's also been a lot of work that shows that children who get exposed to some dirt and germs, I know, shock, horror, we're meant to have 99.9% germ-free environments, who are exposed to just normal everyday bacteria and some dirt, actually develop stronger immune systems and have lower rates of some of these allergic problems. Now, the exact mechanism is not known. One of the theories is that if the immune system doesn't get used to dealing with, if you like, in inverted commas, invaders, then it just will go into hyperdrive, perhaps with other, other elements or other substances that it comes in contact with. So the hyperdrive can be the allergic response, and again, an allergic basis occurs with asthma. These things are not absolutely black and white, and I think it's a really, really important point to make. And certainly not saying that if there is an actual need for antibiotics that they can't or should not be prescribed. The question really is, do we need to use them when they're not necessary? And that should sound like a no-brainer. Of course you don't take something when it's not necessary, but it doesn't always work out that way. Conclusion here, and I'll quote, "The study contributes to mounting evidence for long-term harms from early life antibiotics exposure, underscoring the need for judicious antibiotic use in infancy and early childhood." I mean, it's very, very 101, and you could extend that and say at any age we should only be using antibiotics if we need it. And no, we don't need to be running scared of their use if we're using them correctly. And we have used them over the years too much, and I've seen in the last probably 5 to 10 years much greater, I suppose, recognition in the public sphere and also from doctors. I mean, they're just as bad reaching for the prescription pad. Don't get me wrong, that happens too. But sometimes it is in response to pressure from patients coming in who want antibiotics. But certainly the trend has been in the right direction. And like with all observational data, as a standalone, doesn't absolutely prove anything. But this builds on previous work that has shown similar results. And there's a lot of real-world observational data that supports this. So what's the take-home message? And it's, I suppose, quite apparent and self-evident. We should only use, I suppose, any medication if there's need and if the benefits outweigh the risks or harms. Now, a classic case there is, for example, chemotherapy. That can have very unpleasant side effects for people, but the benefit is there when it's treating cancer. So that there are side effects is not saying that a medication can't be used. But the benefits have to justify the risks. And certainly with any viral illness, there is not a need for antibiotics, and it's not harmless. There is potential downside, maybe not that day, but down the track. So we all need to be aware of that and mindful of that, and all collectively, and this is the medical profession and the public, need to act accordingly. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please like, share, and consider subscribing. Tell your friends. If there are topics you'd like to see covered, be in touch through the chat or email info@drjoe.net.au. We'll be uploading new content each Monday, and soon we'll be putting these videos out on X. You can follow me there at Dr. Joe's DIY Health.